Having a mental health condition does not make you weird, crazy, bad, inferior, weak. It means you're a person that has had too much trauma. My name is Jo Clancy, and I'm a retired clinical social worker. I worked for the Houston VA Medical Center for 30 years. I'm originally from Pasadena, Texas, and I'm an old cowgirl. Came up kind of as a Mustang. I'm a high school graduate or high school dropout with a master's degree. So that's a little bit about my history. How I came to work at the VA, I was a first-year student there. And I did an internship at the Veterans Administration. Never planned to work at a hospital or with veterans, but they had a really good field placement and you learn a lot there. So I did a placement there. Then I went to Family Service Center, and almost about probably 2 or 3 months before I finished my master's degree, an old supervisor called and he said, "I want you to come interview for a job at the VA." I wasn't so sure I wanted to work in a hospital setting. But I went, and he said I basically ran the interview, which embarrassed me. But I told him, I said, "Travis, I'm a single parent. I've got a child with special needs in a day hospital, and I won't ever be able to get there on time, and I'll have to leave early to pick him up, so you probably don't want to hire me." And he said, "No, I watched your work when you were a student, and you work hard and fast, so I think I want to hire you." And he did, and he carried me. So I really do think it was a God thing. I ended up at the VA and with veterans. So that's pretty much how I started that career. I started on a locked psychiatric unit for the first 2 years, and then I worked in outpatient alcohol for 5 years, and then I went to the PTSD program and worked with them for the remainder of my 23 years with the VA. And I would never consider myself an expert, even though people would say I'm an expert in PTSD. What I would say to my veterans is I am the guide and you're the expert. And between the two of us, we might try to get you where you're trying to go. So today, what I want to talk about is a little bit about what post-traumatic stress disorder is, how people get it, why some people get it and why some people don't, and some of the treatments I was doing before I retired that I was getting really good results. The one thing I'll say to anybody listening to the podcast is if you have these symptoms, please go and get some help. There's a lot of treatment available nowadays that really makes a difference if you find the right therapist to work with. You can get back to living a pretty normal life. You'll have your scars, but as we all know, you can live with scars a lot better than open wounds. So what I want to start talking about first, before I talk about post-traumatic stress disorder, I want to just draw a distinction between what is a traumatic event and what is a significant emotional event. And it's important because a lot of people get confused. They feel like they've had a trauma, but the professionals will say, no, that's not really traumatic. Well, it may have felt that way to you, but it might not have actually met the criteria for trauma. Trauma, when you have a traumatic event, it's an event that is something that would normally not happen to you in your lifetime in the culture you're raised in. It doesn't matter what's going on in another part of the world because cultures are different. But say I'm an American, some of the things that would normally not happen to a traditional civilian would be combat trauma. Most of us are blessed not to go through sexual assault. Something like severe child abuse or childhood sexual abuse. Natural disasters, floods, tornadoes, hurricanes, where people are significantly injured or die, or you are significantly injured, or you watch your whole house wash away in a flood or get wiped out by a tornado. Being present during a terrorist attack would be considered a traumatic event. I've had a premature baby that was born at 27 weeks and we spent 4 months in the ICU. That was very traumatic, not something most people experience. And first responders, people that repeatedly are exposed to other people's trauma. It can be very traumatic to watch people suffer, be tortured, die, and you can't do anything to save them or help them. So those things are considered traumatic events. There's another classification of situations that are considered just significant emotional events. And a significant emotional event is something that many people across the course of a lifetime in your culture would encounter. Most of us bury pets if we're people that love pets. We bury our grandparents, our parents. If you're blessed to live old, you're probably going to bury siblings, friends, aunts and uncles, cousins. A lot of us go through divorces in our culture. A lot of us might lose a job or get into a financial situation where we have a car repossessed or a home lost. Those are not considered traumatic, even though at the time they're happening, they feel very traumatic. But because it happens to so many people, they don't consider it a traumatic event. Now, when those things collide, it can be a real significant issue. And when I talk about some of the risk factors for PTSD, I'll talk more about how those two things fit together and why they maybe put you more at risk for post-traumatic stress disorder if you've got a lot of life events going on as well. So that's kind of the difference in those. Now, with post-traumatic stress disorder, the first thing I want to say is not everybody gets it. And I'll talk more later about why, but some of us can be exposed to multiple traumatic events and never develop PTSD. It only takes one event to cause PTSD. And when we're doing an evaluation as a clinician, we do something called an integrated assessment where we're looking at your whole life history, but then we do a very specific look at your trauma history. And we have a certain series of criterion that we use to make a diagnosis. And if you meet the criteria, you get it. And if you don't meet criteria for the full diagnosis. Now, most of us, when we have a traumatic event happen in our life, we'll go through something called an acute stress reaction, where your life is all out of kilter for a period of time. And then it gradually over time resolves and you move back to being where you were before. You just kind of go on and live your life again. It's only when people get stuck that you get the diagnosis. So first of all, you have to have had a traumatic event, obviously, to qualify for a diagnosis of post-traumatic stress disorder. The second criteria, you have to have some way that you're re-experiencing that trauma. And that can be through an intrusive thought, which is like, maybe I'm minding my own business and a song comes on the radio and then this horrific thought slams into my brain about something that has happened to me that was traumatic, and I can't get the thought out of my mind. And it's intrusive because it interrupts everything I'm doing and I can't move forward. It takes a while for me to recover from that. So you can have intrusive thoughts. A lot of people have nightmares. They go to sleep and they dream about their traumatic event. And unfortunately, some of the people I worked with, some of my Vietnam vets, some of the most distressing nightmares, it's called a juxtaposition where things get jumbled up. They'd be going down with a knife to kill an enemy soldier and it would turn into their wife, their child, their friend. And so it makes that nightmare even more traumatic for them because now it's mixed up with their civilian life. But nightmare is another re-experiencing symptom. Some people also have where they actually have flashbacks. And a flashback is where you actually, something happens that triggers a reaction where you're actually feeling like you're back in that situation. And so that person's body, their mind is somewhere else. And their body is going through the reactions as if they're there. And I'll give you a good example. I had a young veteran that had a flashback and he thought he was being attacked by enemy troops. He barricaded himself in his apartment, got out a weapon, and luckily the SWAT team they sent was trained in mental health and they were able to disarm him and get him to the Veterans Administration and get help for him. He had no idea where he was. In his mind, he was back on the battlefield and he was being attacked and he was acting as if he was going to die. So it can be very dangerous for the person that's in a flashback because they have no awareness of their current surroundings because they're not there. So they have to be handled very carefully. It can be dangerous for them, dangerous for other people. For re-experiencing symptoms, you have to have at least one of those, either flashbacks, nightmares, intrusive thoughts. You have to have at least one in order to meet the criteria. Some people also have extreme emotional or physical reactions. And what that means is they'll have this horrific emotional breakdown or they'll have a lot of physical symptoms, heartbeat going up, sweating, that can also be considered a re-experiencing symptom. So one of those symptoms, only one for that category. The second category is called avoidance. And people that avoid, you may be avoiding people, places, or certain things that are reminders of your trauma, thoughts and feelings. Because anytime you think about it, it makes you distressed. So you do anything and everything you can to stay away from it. Some people won't drive cars if they've been in car accidents because they're, being in a car triggers memories. And so they want to avoid those thoughts and feelings so they won't do that anymore. Or somebody maybe that's been in a natural disaster. Anytime, my mother is a good example. We had a tornado hit our house when I was a young adult, and it tore up her fence and ripped up her house, and then it jumped a street and destroyed an apartment complex. If it even rained, she would put her grandfather clock up on her dining room table, and she'd start picking up things because she was terrified she was going to lose everything she had. So just a strong thunderstorm was enough that she would avoid anything like that. I have a niece that was sexually assaulted. She knows her offender. She won't even speak his name. She won't talk about the event. Even when he was arrested, he got a lighter sentence because she wasn't willing to discuss it because she was just too distressed. So you have to have one of the symptoms of avoidance of people, places, things, memories in order to meet that criteria. The third one is called arousal, and it's not the good, fun kind of arousal you think about when you think about sexuality. Arousal is things like having trouble sleeping. You either can't go to sleep, you can't stay asleep, or you wake up repeatedly and you just never get rested. Irritability is a big symptom of people that have that symptom set. When you start thinking about arousal, hypervigilance, and hypervigilance is basically a fancy word meaning you're always on watch. You're always doing overwatch everywhere you're looking. I have a dog with PTSD that does that. If somebody walks in, if she hears a noise, if she sees something or smells something, she starts freaking out. So that can be a big one. Startle response, where someone walks up and you immediately put your fist out. I think one of the saddest experiences I had a Vietnam veteran that was sitting in his easy chair, and his little grandson ran up and growled and jumped on him, and he punched him and threw him across the room accidentally. It was just totally based on a startle reflex. It's not something that you can control. And unfortunately, he lost the ability to then see that grandchild because his daughter and son-in-law did not understand. And of course, the grandchild was terrified. So anything like that would be considered one of those types of symptoms in that category. You have to meet two in that category. And then they've added one since I retired called cognition and emotion symptoms. And that's either not being able to feel joy or have feelings. You just can't have good feelings, happy feelings, or you have an abundance of guilt, shame, blame, anger. Irritability is a big one. And not being able to, or feeling like it's your fault, even if people confront you with evidence to prove that it's not, you feel like it is. So that can be a big problem. Negative thoughts and beliefs about yourself, other people, or the world, like the whole world's out to get you. It's not safe anywhere. Everything's dangerous. And you have to meet two of those criteria. And that's new since I retired 7 years ago. They added that to the criteria. So you have to meet two of those. So if you have re-experiencing, you have avoidance, you have the arousal symptoms, and then the cognitive and behavioral symptoms, you meet 1, 1, 2, and 2, then we can give you a diagnosis of post-traumatic stress disorder if you've had symptoms for at least a month, and if it is significantly impacting your life. So I still disagree with the 1 month level. I've had some traumatic events in my own life. I don't have post-traumatic stress disorder, but it certainly took me more than a month to get past it. So they consider it an acute stress reaction for 30 days. And if it continues, then they change the diagnosis to post-traumatic stress disorder. I think it should be further out. My clinical opinion is it should be further out. And it has to interfere with your life to the degree that you're having trouble going to work, you're having trouble in your family life, trouble in your social life with friends, things like that. Because if it's not interfering with your life, then it's not a problem, and you wouldn't get that diagnosis. Now, some people get angry because they say, well, I have this symptom, or I have that symptom. Well, if you don't have enough symptoms in all the categories, you may not get the diagnosis. And it doesn't mean you're not having trouble, but it means you don't meet the diagnosis at the clinical level. And for an average person in civilian life, that might not be significant. For veterans, there's a whole nother layer to that, because then we have service connection. And if you don't meet criteria, you're probably not going to get service connection. So there's a money piece tied to it. And that upsets people sometimes, because they feel like my whole life has changed, and it has. And thank God I'm not the one that made that decision. The money people do a whole different thing than the clinical people. But having post-traumatic stress disorder does not mean you can't live a productive and good life. But however, if you're unable to resolve those symptoms on your own, at that point, you probably need to go and get some help, because I don't care how good you are. I've been in psychotherapy myself. Sometimes you cannot resolve things on your own. And, you know, people would say, but you're a master's level clinical social worker. And I'm like, yeah, but I'm also a human being. And when I've had trouble, I've seen psychiatrists, I've taken medication, I've seen clinical social workers, because when you're in the middle of it yourself, you can't be objective. And all of us. And what I said in my book, Desperate Disguises, I wrote a book called Desperate Disguises, Living in the Shadow of Psychiatric Illness many years ago. And my favorite phrase that I wrote in that book is, any one of us could be any one of you, and many of us are. Having a mental health condition does not make you weird, crazy, bad, inferior, weak. It means you're a person that has had too much trauma. And for trauma survivors, one of the examples I use when I would teach veterans, if you think about the Twin Towers before they fell, they were steel reinforced buildings built to withstand hurricane force winds. Nobody ever imagined that someone would drive airplanes loaded with jet fuel into them. Those heavy steel beams reached a certain degree of heat and they melted, which is why the towers pancaked and fell. So even steel, you put enough heat or torque on it, it will bend or break. Human beings are the same way. And all of us have a different breaking point. But at some level, all of us reach a point where there's no further that we can go. We have a certain amount of resilience, and then you got to rest, and you got to get help, and you can pick yourself back up. And like I said before, you can live with scars, but living with open wounds is really hard. And hiding from the illness, I think a lot of times people are embarrassed or ashamed. And that's why when I wrote my book, Desperate Disguises, I had to get people to write reviews. And it's dedicated to my sister who committed suicide. That's why I wrote the book. And one of the psychiatrists that wrote a review for my book said, I can't believe you're saying this. You're going to say that your family member not only had a mental illness, but killed herself. If I don't, who will? If we don't talk about it and we don't bring it out in the open, how are we going to help people not kill themselves? Because the bottom line, having PTSD or depression or anxiety or schizophrenia or any other mental health condition is like having cancer and diabetes, heart disease, anything like that. They're just illnesses. And if we've got a treatment available that we can help somebody have a better life, why would we not do that? And I talk about it because I want people to feel comfortable saying, I have depression, I have PTSD, just like I could say I have diabetes or cancer and nobody blinks. And in the 35 years now since I began my career, it's better, but people are still afraid. So we have to keep saying, this is not something you need to hide from or feel ashamed about. It's just something that is. What are you going to do to fix it? And if you can't fix it on your own, which most of us can't, are you willing to get some help and let somebody move you along that path so that you can get back to living a normal life? People often ask, okay, so I've had a trauma and you've had a trauma and we've had a similar trauma and I get severe PTSD and you don't. How come I got it and how come you didn't? Well, there's a whole lot of factors that play a role. There's what we call protective factors that will help you not get it, and there's also risk factors. So I'll talk about risk factors first. Risk factors are things that put you at higher risk, and you can have risk factors and still not get it. It's kind of like having heart disease. My father dropped dead of a heart attack at 44, so I'm at higher risk. Does it mean I'll die of a heart attack? No, but in my 40s, did I get a cardiac workup? Yes. So one of the risk factors for PTSD is the age at which you're traumatized. And obviously, the younger you are, the more it's going to impact you because you don't have usually the social supports or the skills that you would have had if you were an older person. I can give you an example from my life. When I was 12 and a half, I had begged my father for a horse for years. And he said, if you can save the money, you can get a horse. And I went out and mucked stalls and mowed lawns, and I had a horse. And 2 weeks after I bought the horse, he was at the stables we were renting, fixing the stall. And then he drove home. And I rode my horse home. And I opened the back gate, and he was laying on the patio. And something was terribly wrong. And he looked at me and he said, get help. Well, I'm a 12-year-old, and I was raised in a family where I wasn't one of these kids that would have picked up the phone and called. I didn't know. I just freaked out. And I ran around the house, banging on windows, screaming and crying for my mother and my older sisters. And back and forth, back and forth. Finally, the poor guy gets up, he staggers down the driveway and has me help him to a neighbor. And the next time I saw him, he was in a coffin. So I felt like I killed my father. I didn't know how to ask for help. And I remember my mother, she was young, she was 42, my father was 44, and nobody knew what to do. I would sit and cry and hold my dog, and I had a horse, and I would sit with the horse, and she would hug me back when I would hug her neck, and I would listen to my turntable, but I didn't ever ask for help because I didn't know how to ask for help. And I would have had available supports because I had people that loved me. I didn't know how to ask for help. Now, I'm lucky I didn't get PTSD because I went to a therapist in my 20s and fixed the resolution, and I'll talk more about that when I get to hindsight bias. But being young, and if you think about Vietnam veterans, most, were young. This was a war of young people right out of high school, 18, 19, 20 years old. So you're just starting to live your life, and we think we know everything when we're teenagers, and then you get about 35 and you realize how stupid you were and how little you knew about the world. And you're seeing things that you have no framework for. You can't put this into anything you've ever learned in your life because what you're seeing and experiencing makes no sense. And it's just horrific. So younger people do worse. Doesn't mean you'll get it. I didn't. But it puts you at higher risk. Obviously, the more times you're traumatized, the more likely. Again, it's like the steel. You hit it enough times, it's going to fracture. You hit a person's psyche enough times, eventually, I don't care how strong you are, the straws are going to break and you're going to fall apart, at least for a little while. So multiple exposures put you more at risk than one. Whether you have social supports, people that are more at risk either don't have them or they won't use them. And for veterans, a lot of times, if you think about it, here I am, I work for the VA Medical Center. Hi, I work for the government. I'm here to help you. Sure you are. That's who screwed me in the first place, and I'm supposed to trust you? So, I'm not going to use that support and then being male or being, as my female veterans taught me, I'm not like you, I'm like them. The stigma of asking for support, or say you're active duty and you're having symptoms, do you really want to go report that? Because then it's going to affect rank, it's going to affect a whole bunch of stuff, so you just shut up. So a lot of times people, even civilians that have been through stuff, they don't want to tell anybody because they're ashamed or embarrassed or whatever. So we'll just not talk about that. We'll just not talk about that. So even if you have support, if you don't use it, that's a risk factor. Having no coping skills or not good coping skills. A lot of people drink, use drugs, do reckless behaviors, things like that, because they just don't know what else to do. And so those would be considered poor coping skills. They're going to put you more at risk because they're not moving you in the direction of recovery. They're just moving you in the direction of staying stuck and spinning in circles. But if that's all you know how to do and it's keeping you from killing yourself, I'd rather see you get drunk or get high than kill yourself, but let's see if we can get it another level above that so we can keep you from killing yourself and you get healthier. So that's a big risk factor. First responders are people that have risk for PTSD, and they didn't used to think about that, but they finally developed critical incident stress debriefing teams for firefighters, paramedics, people that work in emergency rooms, because they see a lot of people in extreme pain, suffering, dying, mangled, dead, and giving them a place to process that. If you're a first responder that does not participate in debriefings, you're more at risk. So all those things can kind of make you more susceptible to developing post-traumatic stress disorder. Some protective factors, being older, because by then they go hand in hand. By the time you get older, you've got more coping skills, and you've got more social supports. When my husband and I had a baby, I was 35, he was 42, and this baby was born at 27 weeks. We spent 4 months in an ICU. In the beginning, it was devastating, it was overwhelming. But then as time went on, we were the old parents in the ICU, and we were comforting the younger ones because they had no idea what to do. And we're both clinicians, but that didn't matter. We're both master's level social workers in mental health. When it's your own trauma, that's absolutely worthless. But we had social supports. All our friends work in psychiatry. So we had a lot of support from friendships in psychiatry. We had family. We had our church. I walk. I do mindfulness. I do read. My husband was a marathon runner back then. So we did a lot of healthy coping skills. If you have coping skills that you're willing to apply that are healthy skills, and if you have good supports and you're willing to apply them, you're less likely to develop post-traumatic stress disorder. And I think people sometimes think, well, if I get it, it must be I'm inadequate or there's something wrong with me. No, because you can be a really well put together person that has good coping skills, and you can still, even with good supports. And like I said, you get hit enough times. And I have very few combat veterans that I worked with that had one trauma. Most of them had repeated exposure to trauma over a period of time. I don't care what kind of coping skills you've got. When you've gotten battered that many times, it's just really hard to walk away without having some aftermath. As I said, usually the first 30 days is considered an acute stress reaction. Most of us are going to be not functioning well, not sleeping, maybe having nightmares or feeling anxious or avoiding things, being angry or kind of even blunted. And then if it continues beyond 30 days, it becomes post-traumatic stress disorder. There are cases when people are able to put that away, and years later, that's where your significant emotional events can play a role. Maybe you go through a divorce, or you lose a job, or because you're older and you're starting to have some physical consequences, you lose your ability to ambulate, you can't be mobile anymore, or you can't do the things you used to do that make you be able to cope. It may come out years later. So there are people that have horrible trauma and they do fine, and then maybe a significant emotional event, a divorce, a death of a loved one that was very significant to you, brings all that back. And I've seen veterans that they shield it really good. Some people have the ability, and what I did when my son was in the ICU, because I can do it too, I would put him in a little box. I would go see him in the ICU, and then when I would leave, I would put him in a little box and I wouldn't think about it. And the nurse, I still remember the nurse would call and she'd say, you can call anytime you want. I didn't want to call. Because if I put him over here in this little box and I don't think about him, I can go to work. I've got 2 other kids at home I can raise. I can clean my house. I can cook. If I sit and think about that, I'm going to go absolutely crazy. So a lot of people compartmentalize and they put it in this little lockbox. But later in their life, something else happens and it all comes out. Because it hasn't really gone anywhere. Trauma encodes in our brains very different. Regular memories, we have short-term and long-term memory, and it encodes in our brain. When you have a traumatic event, you don't have what we call a conceptual framework. There's nothing in your ordinary life that you can tie it to make sense out of it. Because humans have a tendency to want to do what we call deductive reasoning. Why did that happen? And if we can make sense out of it, then we can make our peace with it and move on. When something that's so outrageous happens, you can't make sense out of it, so you've got no way to justify it or to make sense out of it so you can move through it and keep going. So people get stuck. And with trauma, it's like having a 4D movie in your head. It goes on, it's technicolor, it's loud noise, it's right in your face. I've worked with people that had traumatic events 50 years ago, and I would have tears running down my face because it was so present in my office, it was overwhelming to me. because it was just that fresh. Trauma is fresh until it's processed, and I'll talk about one of the treatments that I love the best when we get to that. But yeah, you can either have it happen, fairly soon, or years later. So some people are quite shocked. I had one guy, I really loved him, and he said, I don't even believe in this PTSD crap. These guys are just doing it to get money. And he came in and he finally came to me and he said, I think I really have it. I said, why? He says, because I've been to the emergency room 3 times and they're telling me I'm having panic attacks. And then he realized he had a significant traumatic event that he finally processed with me. He said, but I always thought only weak people fell apart. And I thought I was just fine because I worked a career and I had a wife and I had kids. And I thought I was just fine. And then I just fell apart. But he had had some significant emotional events happen in his life. I think he had a significant heart problem, and he had some other things happen and lost a family member that he loved, and then it all, somebody pulled the string and it all fell apart. Well, and if you lose your ability to use like you get old and you can't, if you're a runner and you can't run anymore, if that's your major coping skill, what else are you going to do? You better develop another coping skill. But that's easier said than done. I mean, I walk 8 miles a day. If I got where I couldn't walk, I probably wouldn't be so good. Because that relaxes me. It gets all those endorphins going. It lets me get through everything I've got in everyday life. Because it's a real healthy coping skill. Well, when you've had things happen to you, when you've got a picture of how your world is supposed to function, and it turns upside down through no fault of your own, but you stop believing in all the things you did. A lot of people lose faith in God, and they turn away from everything because everything that seemed solid is now fluid. And what I see may not be what's real. Do I really want to trust that that's what it is? Because I trusted it before and look what happened. So you really have a lot of second thoughts about what's real and what's not real. So yeah. That's hypervigilance. He was always looking for that enemy. He was always doing Overwatch, trying to make sure nobody was going to come. Because if somebody's done it in the past, they could do it today. A lot of us, and one of my veterans would tell me complacency kills, because you relax your guard and you don't think about things, and then bad things happen to you. Well, they can, but you don't have to freak out all day long every day. But if you've been in situations where your life was at risk over and over and over again, do I really want to take that chance? I had a doctor that I worked with that was from I think she was from Lebanon, and she said when I was a kid, if you saw a paper sack in the road, you went around it because it would blow up. She said, so even in America, if I see a paper sack on the road, I won't drive over it. I'm afraid it'll blow up, because that's what she learned. And so you pick up patterns of behavior, and it's hard to put those back down. And it's like even the dog that I have, she's very hypervigilant. She startles easily, and if you put her in a corner, I would assume she's been beaten, because she gets very defensive, even though I've had her 3 years. We think we're smarter than the other animals, but we're really not. When you put us in a fight or flight situation, because the things that humans will do, you fight, you flee, or you freeze. Those are the 3 reactions human beings have to traumatic events. And a lot of people feel guilty if they freeze. I've had people say somebody had to knock them down in combat because they just stood there. Some people will charge forward, and some people will just freak out. I mean, it's just, and you don't know what you're going to do until you're in that situation. So it's easy to say to somebody, oh, I can't believe you did that. Well, how do you think you perform? You won't know until you're there. And no one of us is going to know how we're going to react. And as a clinician, people would say, oh, well, y'all are good because you know what you're doing. And we're like, no, we're not good. Because when it's your life, you're just a human being. And you're going to react like everybody else. Your training goes out the window. So, yeah. But that hypervigilance is something and it's very distressing to the rest of the family and everyone else, because they're acting, to an average person without PTSD, it's very abnormal to have people shooting in fields and having you hide here and go there and act this way. But to them, it's perfectly normal behavior because it saved their life before. And I don't want to die, so this is what I do. And they forget to remember in the context of where they are is not in the context of where they were. But it gets fused together. So no matter where you are, you're still having that experience. I used to do multi-couples groups, and then I did family workshops. A lot of divorces. A lot of issues with children because there's issues of not being able to get close, not being able to show positive emotions, being angry all the time, not being able to function. A lot of people, when they have severe PTSD, either can't work or they work in jobs that work for them where they're away from the family quite a bit. Truck drivers, oil field workers, lots of very high paid jobs that are good jobs, but they're out there, they're their own boss. They may have to pick up here and drop off there or do this and that, but people leave them alone. And so that works for a lot of families, but it's hard on the family because they don't understand. That's why I did family groups, because who better to help you than other couples? I did multi-couples so that they could talk about it. And then I did a family workshop in Tomball when I was at the outpatient clinic. One Saturday a quarter, I would hold a workshop and have them bring family members to learn about PTSD and treatment. And no, you're not crazy, and neither are they, but this is why it's affecting your life, and these are some of the things we're going to offer your veteran, but also want to offer you some support too, because it's just hard to be out there and not know what's going on. Families can invite and encourage people to get support, but a lot of times, again, they shut down because either they're in denial and don't want to admit there's a problem, or they just don't want to approach that. You don't want to go into treatment with the government that wounded you is now supposed to help me. Yeah, well, sure it is. And there are people at the VA. I loved my job and I love my veterans, but there are people there for a paycheck. And it's like, until you get to know us, how do you know which one of us is there for the paycheck and who's really caring about the veteran? And for veterans, I had the other layer for me. Well, number one, I'm female, and they didn't have females in combat back then. And number two, I'm not a veteran. I've never been in combat, so who the hell are you to tell me how to get better? How can you help me when you have no idea what's wrong with me? And it's like, well, I'm a guide. You're the expert. Together we work it. Well, part of the reason I did the workshop was to teach them about symptoms and some things to do and not do. You don't walk up to somebody that has severe PTSD. You don't come up behind them, even though you don't mean anything. You walk into the room, hi, honey, and what happens usually is it startles the person and they immediately become furious, and that's a response to threat. So you announce yourself. When they're angry, you give them space, or if somebody needs space, instead of continuing to bother them, let them go have some space. You know, don't pester them to death. And then go get support for yourself. But there wasn't any support for families back then. Nobody did anything for the families. That's why I built groups, because nobody was doing anything. And it's like, how can, you got half, because I had a lot of wives would say, well, he's getting all this help. Who's going to help me? So then I did the couples group, and it was they were so good together, and they really helped each other. So, but they're, just learning about it, so you have a better appreciation and understanding he or she is not doing this because they're a bad person or because they want to do it. These are symptoms of something that's going on related to their trauma, and these are some things I can do that might help, and these are some things I do that are going to make it much worse. But it is hard for families. And back to the symptoms, the cognitive and emotional symptoms, one of the things I forgot to mention when I was talking about risk factors, either seeing people tortured or killed or seriously injured, or having to kill someone, or having a serious injury yourself is a real risk factor for PTSD. And in a few minutes, I'll talk about hindsight bias and also least bad options, which is very significant when I do treatment with people, or I did treatment with people, because sometimes there is no good option, so you're looking for the least bad one. And that's an important piece of it. Now, I'm rather unconventional as a therapist. I would hug my veterans if they wanted hugs. It's good I retired before COVID. I would have died. I went to telehealth for a while. I got a promotion. I gave back. And in my jacket, it says demoted at employee's request, because I can't do telehealth. Well, they call it telehealth, but telehealth for me. And I had a lot of pictures in my office of me, of my family, of pets, of trips I've taken, because I wanted something I could join with people. Because when you've got somebody that doesn't trust and hasn't had good rapport with people, you've got to have a way to build some kind of relationship, or they're not going to do the work. Because trauma is something you don't want to share with anybody else. It's too painful. So even in the initial interview, we did do something which I mentioned in the beginning called an integrated assessment, where we're looking at your childhood, your legal history, your substance abuse, your employment, your education, your marital history. And we go through all of that, and then I'm starting to ask you about trauma. And we're doing it on a computer by the time I retire, which is so, it's not the best way to do it. Well, I would stop and chat with people in between. I can do a 90-minute interview in 90 minutes because you're going to get it done faster if you join with somebody than if you're having to pull teeth. So if they'd say something about a picture of my dog or my horse or a trip I have where I'm standing on a mountain or some little artifact I have in my office, we'd stop and take a little side trip and chat about that. And if you ask me if I have children, I'll say, yes, I do. I'm not one that would say, why did you ask that? Because I'm trying to get that person to understand I may have a degree, but I'm just Joe. I always went by just Joe. And if I'd have gotten a PhD, I still would have been Joe. And my friend Darlene Witcher is a PhD, and she was just Darlene. And she was a doctor. But if you come as a person, meeting a person where they are and saying, I'm no genius here, but I truly care about you and I want to help you. You start that in the interview process. So by the time you get to the end of the interview, the person has at least realized maybe this person, maybe there's some substance there. And a good example, I had a veteran that I did an interview with, and I set him up to come see me the next week. But there was some reason the next day I went to work and I had a feeling, I just had a bad feeling about this veteran because I kept thinking about him. There was something, he denied all the suicide questions, all of that, because you ask all of that. But I just had this feeling. So the first thing that morning, the next day I got to work and I called him. And I said, hi. And he said, what are you calling me for? I don't have an appointment with you till next week. I said, I just woke up today. I was thinking about you. I'm worried about you. I care about you. And I want you to give me a chance to help you. Because I really think that you can get better. And you were so courageous to come in. And because I'm thinking about you, I just thought I shouldn't think about you. I should call you and say that. He says, well, I'm fine. I said, okay, well, I'll see you next week. He came in the next week and he said to me, thank you for saving my life. I said, what are you talking about? He said, when you called, I had sent my wife to the grocery store. I was sitting there with my weapon in my hand and I was going to shoot myself. And he said, I don't know why I answered the phone when it rang, because I never answer the phone when it rings. But I answered the phone and it was you. He said, and you said you really cared. And I got to thinking about it and I said, well, damn, if she calls me and we don't even have an appointment till next week, she must care some, because why else would she call? He said, you made me curious. So I thought I would at least give you a chance. I can always kill myself later. And I went, oh my God. I mean, so that small, little tiny thing made a difference. And he gave me a chance, and he ended up going through a lot of treatment with me, and he did really well. So he did survive. I didn't save his life, he saved his own life. But God put that little thought in my brain that you probably need to reach out to this person. And it ended up with a good outcome. But, there was something he said there in that interview. And I probably wouldn't have gotten that had I not gone off script and done some of the talking about the pictures and the artifacts in my office with him so that we could form some kind of relationship. But then there was just something off that I felt that he said. It was like too upbeat or it just didn't ring right. So then I thought about it and called. That was just a blessing. That was just a blessing. So treatment always starts with the interview. And then the second thing I would do, because veterans don't trust, and you can't blame them, especially Vietnam veterans, because of what happened to them. A lot of them were conscripted, and you're sent to this hideous thing, and then they came back to a country that hated them. You forced me to go, or I'm going to jail or Canada, and then I come back and you hate me for doing what you sent me to do. That's a heavy burden. I mean, the veterans nowadays, thank God, get treated well. But the Vietnam veterans, they were young and they were traumatized and they were re-traumatized, probably more by their own country than what they experienced because of the way people treated them. So I don't expect you to trust me, because who am I? I work for the government. I'm your friend. Sure, Joe. So I would invite them to participate in my Life After Trauma group. It's a 12-week series of educational classes, 90 minutes a week, and I'm standing up teaching a class. And I like to do a lot of back and forth banter. I tell a lot of stories, invite people to tell theirs. But basically, I'm teaching you about PTSD and risk factors and all that and treatments and how it affects your family and coping skills, and we're going through this. But during that time, you're getting to know who I am, because I'm pretty much presenting who I am and telling my own stories and doing stuff. So by the end of 12 weeks, you either decide I'm okay or I'm not okay. And that's how I got a lot of people into more intense treatment, because it's like, okay, you've seen me 12 times in 90-minute blocks after that assessment, and if I'm going to screw up, you're going to probably see it before then. You know, if I'm not pretty true to who I say I am, you're going to catch me during those 12 weeks, because they paid attention. And I had one guy, he said, I just thought it was total BS, but he said, I thought I'd give you a chance, and damn if it didn't work. You know, but you have to build that relationship. For me, that was the most important piece to ever get anywhere with anybody. And then I would invite them after that. There's 2 other treatments that are what we call evidence-based, meaning they've been developed by people with PhDs or higher, and they've been tested with research, and they work. Okay, and I'm not real big on that, but the 2 I learned that I used really do work. And the first is called cognitive processing therapy. And basically what we're trying to do is help you look at how you think about things and help you look for errors in thinking related to that event and help you come up with a different script. And people that have a lot of guilt, shame, or blame are really good in that therapy if you can talk them into doing it. It can be done in 12 individual therapy sessions, 90 minutes each, or 12 group sessions, 90 minutes each. I prefer group because I need experts, which are my veterans, to challenge your thinking. Because if we're looking at sexual assault or combat trauma, I can't speak to that because I've never experienced it. If I'm challenging your thinking in individual therapy, you're going to just use that. You can rationalize, she don't know what she's thinking about because she's not anybody. If another veteran is saying, that's just crap, or why would you think that way about that? Or did you ever consider it this way? It has a lot more credibility than I have. And I fully admit that because I don't have that credibility, nor will I ever, because I'm blessed to have never been to combat. So in cognitive processing therapy, 2 of the things that get in the way the most of people, the first is hindsight bias. You look backwards at a situation and go, oh my God, I wish I'd have done this, or I should have done that, or, if only this had happened, I could have done this. And with my father's situation, when I was in therapy in my 20s, the therapist said, okay, you're sitting here at 21, 22 years old. You were a 12-year-old kid back then. What would you do different now? Well, my God, I would have taken his key out of his pocket and gone in the house that was locked and called O for operator and asked him to send an ambulance because we didn't have 911 back then. Or I would have run next door to the neighbor and I would have asked for help. And he said, so you're punishing this totally traumatized child because I just panicked and didn't know what to do because I had no idea what to do. This is the rock of my life who's laying here dying and I'm not knowing what to do. And he really made me think about that. Well, when did you figure out you could have got the key? Did you think about it that moment? No. Did you think about it days later? I said, no, years later. He said, well, then how can you punish that poor little child for making that choice when that's the only choice she knew how to make was run around and bang on the windows and scream for her mother and her sister because that's what she knew to do for help. My sister's 9 years older and a nurse, and my mother was a nurse. And I didn't know what else to do. So I did what I knew. And I thought about that. And he was very helpful in helping me look at that because it's like, I never thought about it that way. He said, you should. And when people commit suicide, we're often, if only I'd have seen this sign or known this or paid attention to that or sent this person or made this call or made this comment or done this, that person might not have died. Well, when did you figure that out? They were already dead. Well, if you could wind back the clock and do it again, of course you would do it different. You'd make the call. You'd ask the different person. You'd reach out to the police. You'd do this. You'd send somebody. You'd remove a weapon. You'd do whatever you need to do. But if you don't have all those pieces, then it's not really fair to make a judgment. Plus, if you're in a crisis, you're not going to think like you're thinking when you're not in a crisis. I mean, I'm really calm when I'm the therapist and I'm dealing with your trauma, but when it's my trauma, I'm a mess. and it doesn't matter because you can't be but what you are. So that hindsight bias, a lot of times, people will make choices or decisions and then later regret it or wish they'd done something different. And even then, you don't know if it would have changed the outcome, which makes you crazy because it's like, well, even if I'd have done this, would it have changed the outcome? Well, God is the only one that knows that. We're never going to know that unless it was like my Uncle Joe that says it'll be ever so clear when you get to the other side. But in this world, we won't have that information. So hindsight bias is very dangerous to trauma survivors because I should have known to, I should have left the scene. So, they told us to clear out before that hurricane came, or I should have put us in the tornado cellar, or the flood was coming and I kept my family there anyway because I thought we'd be fine, and we weren't. And so it's my fault they all died. Or I should have held on tighter, or tied a rope on this one, or done this to that one, or with the terrorist attack, I should have done this, or run this way or that way. And then there's a lot of regret if you survive and somebody else doesn't. Why was it that person and not me? And in retrospect, that's just the way the cards fell. There's no way to explain that. Here, we don't know. So hindsight bias. So you're helping a person kind of look at historically, okay, well, now you have all these things. When did you know that? Because if you didn't know it at the time, it doesn't count. You can't use it. And then coming up with a different way to look at that so that it's kind of like the guy said to me, you were a 12-year-old child that was in absolute terror. I couldn't even think, much less think of anything constructive to do. So I did what I knew how, which was absolutely nothing except freak out. And that's the best I could do. And you can only do your best even if it's horrible. The second thing that gets people in a lot of trouble is something called least bad options. Because you're always looking for a good option. You want to do an action and come out with the best possible outcome. Sometimes there's not one. So you're trying to pick a least bad option. And for combat soldiers, I think the worst case, and I'm sure he would be happy for me to share this because it's been at least 25 years and I won't mention his name, so it's okay to share the story. I had a veteran that was at an outpost that was up on a mountain in Vietnam. I won't say where. And there was a Vietnamese village here, down at the base. And the NVA, which was the regular army, the real Viet Cong, they were pushing these civilians up the hill towards the outpost where they were going to overrun it. And they were using the civilians as shields. If they turned around, the NVA killed them. If they came forward, the Americans had to kill them. So they're shooting them with M60s, and that's the guy that described what happens to a body when an M60 hits it, it just explodes. They were killing women, pregnant women, babies, children, old people, and these people are screaming and crying, but if they try to run, the NVA kill them, they come up the hill. They slaughtered hundreds. And finally, air support came in and took out the NVA soldiers that were hurting these people up the hill, but there was all this disaster. Okay. You feel really bad. I can't even imagine in my worst nightmare what that would be like to survive that. And he said when they went to do body counts, they, bulldozers to do bodies into mass graves, but with the children, they picked them up and placed them because they just couldn't bear to bulldoze them. But he said, we're such horrible people, but that was the least bad option. The best option is nobody dies. The least bad option is we don't die because it's either us or them. Because if they'd allowed them to come up the hill, all the Americans would have been overrun by the NVA and killed. You don't want your own people killed. And unfortunately, Americans are very tender-hearted, loving people. And American males protect women and children and old people and disabled people. They'll die for them. So how better to screw them up? We have them kill the women, the children, the old people, the disabled people, because they're killing these innocent people that are so at risk, and you're really screwing them up. Another example, least bad option, you've got this little child that's got a bomb strapped on it, and it's walking towards your squad, and you've got a choice. You're calling to it in its own language, and it won't stop. You can shoot the child and watch it explode, and you've had to kill a child, or it walks into the middle of you and kills all of you. least bad option, you save your squad. But do you feel good about shooting that child? No. And then I think for the Vietnam vets to be coming back to a country that called them baby killers, not understanding that in the context of where they weren't baby killers. They were neutralizing a threat that was going to kill all of them. They didn't have a choice other than to just die. You know, I had another guy that they were moving through a village and they took enemy fire from a hooch, and the squad leader had to order return fire. And when they went after the action ended, there were 2 dead women in the hooch and 2 dead children. But there was also dead enemy soldiers in there. What are you going to do? And he felt horrible because he gave the order. So he was 20 years old. He was ultimately responsible. What choice do you have that's a better choice? Least bad options. So that a lot of times there are no good options. And even in civilian trauma, or in any mass casualty situation where you've got people responding, you're going to triage. Well, okay, this one looks a little bit better than this one, so we're going to treat this one first and we're going to sideline this one to second. Well, this guy ends up being so hurt he dies, and then this one dies because they had internal bleeding that you couldn't possibly have known about, so they both die. So I'm a terrible person because I should have treated this one first, and at least I could have saved one. You don't know that. You did the best you could in a crisis situation to triage with what you could see. And if you think in a combat zone, you've got limited training as a medic, you have filthy conditions, you have very few supplies to work with, and you're young, and you're doing I don't care if you're God, people were going to die. It was just a lot of my medics really suffered with that because they couldn't save them. Or you have somebody that you have to leave behind because, and you don't leave anybody behind, but in order to save one person, you're going to lose 15. Think of firefighters. I feel sorry for the person that's the chief and they're at a fire scene and they have to order the fire department to pull out, and there's still people screaming for help, but you can't, or you're going to lose your firefighters and they have to let those people perish. My husband was a debriefer at a fire department scene where a family burned to death in a car, and they were screaming and crying for help, and it was so the firefighters could not. And then the father had somehow gotten out of the car and this guy was wandering around and they were telling him to get back, and then they realized he was part of the accident. And they had to have a debriefing for that because they could not save that family. There's times when and I would not want to be the person making the choice because, on this level, it's the correct choice because it's the least bad option, but there is no good option when people die or when people are seriously injured or mangled or tortured. What are you going to do? So with cognitive processing therapy, you're trying to help them look at, number one, with hindsight bias, what did you not know and would it have made a difference anyway? And then, were there even any good options available? And if not, what's the least bad option that you have? With our son, when he was in the ICU, he developed retinopathy of prematurity. And your eyes grow like this, and at 40 weeks, they finish. When you're on oxygen, like he was for 9 weeks, and they take it off, sometimes the vessels grow sideways and rip your retina off and you go blind. So we were presented with the option of, okay, we can destroy his peripheral vision and put scleral buckles on to try to hold the central vision so he can see something. If we don't do that, there's a 90% chance he'll be totally blind. 10% chance it'll resolve itself. We got a second opinion that said the same thing from another hospital. We didn't trust him. We did the surgery. That's not a good option. It was the least bad option. When he had sepsis, they said, we've tried all the antibiotics except one. This antibiotic will cure it, but he'll either end up deaf or hard of hearing. What do you want to do? I want door number 3. There was, so we did it. He ended up hard of hearing, but he had some hearing, but he would have been dead otherwise. We had so many blood transfusions and we run out of donors that we knew. We got to give him one, but there may be something in the blood that could kill him. What do you want to do? Well, he got lucky on that one. He didn't get anything, but you don't know. And those were least bad options because we don't know. Are you going to willing to take a chance? 10% chance he might see and be normal. 90% chance he'll be totally blind. we fought about that one because my husband was like, well, maybe. I'm like, no, we'll divorce over this one because I just can't put him in the dark. Fortunately, nowadays, the doctor that was his ophthalmologist has developed a cure. They give one shot in each eye and it cures them. They don't get it anymore. They don't lose their sight. It's beautiful. I wish it had been my son, but it wasn't. But I'm glad for all the babies now because now there's a cure. But least bad options are just not a good place to be. But when you're doing cognitive processing therapy, you're trying to help people look at that. If you had other choices, you would have used them. Sometimes all you're trying to do is reduce the amount of damage. If you can't prevent it, you try to reduce it. So cognitive processing therapy is very valuable when you've got guilt and shame and blame and all of that. So I liked using that one in a group format. The other therapy that I became quite fond of, and I fought with the administration a lot because it takes an hour and a half for each veteran, and I did 10 of them a week. And I just said, I'm getting good results. I'm showing you research data that shows you I am. Leave me alone. Because they wanted to cut it down or to do this or to do that. It's called prolonged exposure treatment, which in the old days was systematic desensitization. But basically what you're doing, what I would do is, by now I've got a relationship with a veteran. I've done a lot of treatment with them. And I'm saying, okay, I got this one last big gun. And it's a good gun, but it's going to be painful as hell. Because I'm going to teach you about this treatment, and then I'm going to take you through your worst traumatic event over and over and over and over, and I'm going to be asking for sights, sounds, smells, thoughts, feelings. I'm going to put you back there. And then we're going to be taping it, and you're going to be listening to it every single day at home in between our sessions. Because what you're trying to do with prolonged exposure, when a trauma happens and the memory fuses to the event, like I talked about earlier, it's right here. Even 50 years later, it's here. So with repeated exposure to it, what we're trying to do is separate the memory from the event so that when you think about it, now it's a piece of history and it's a horrible event that really happened to me, but it's over here. It's not here. So it's about separating the trauma from the event. And when I would do the trauma history, some of them had multiple traumas, they'd give me a trauma and I'm like, no, that's not it. I'd wait till the one that they cried about. That's the one we want to process. Because the good news is, if you can process the one, it kind of helps with others. And I had a guy, actually, he processed with me. He was a NASA engineer. He had been a combat veteran. He didn't process such combat trauma. He was at NASA when one of his former employees came in and held the boss hostage and killed him. And he was present during that. The only reason he wasn't killed is because he had been nice to this guy. And he was under somebody else that wasn't so nice to him. He came back and killed him. And that bothered him more than the combat trauma. So, but he told me, he said, I didn't even believe this crap would work. He said, but I had to do everything you told me so I could prove to you it was a bunch of BS. It worked. And he came back and he said, I'll be damned, it worked. Because you're processing it out, and I can't comfort you while you're doing it. I've had people throw up. I've had people with snot running down their faces, sitting in my floor crying. And afterwards, yeah, I will give you a hug when you're done. I'm sorry. If the VA didn't like it, I didn't care. I hugged them anyway. Because if you're willing to go through that with me, I'll hug you. But people are able to look at some experience that has been so distressing to them for so many years and actually be able to make peace. I had a veteran that I really loved. Actually, I have a pair of desert camis that his son, who was an Afghan vet, gave to me because his father, that was a Vietnam vet, is the one I helped, got so much better. The son wanted to thank me. So I use them here to work around the property. He gave me the hat and he gave me the whole outfit. And they fit me. He was tiny. But his father had been a young soldier in Vietnam, and they were on a mission and got ambushed, and his buddy got both legs blown off. And he, under fire, carried that buddy off the battlefield, and the buddy's on his back, bleeding out, crying, please save me, please save me, please save me. And he gets him over to a safety, he's dead. He dies before he can get him there. And he carried that buddy with him all those years. And after he did prolonged exposure, he told me, he says, I finally was able to make my peace with him and let him go on. And that's a beautiful thing. It doesn't make it any less sad that his friend died a horrible death, but he understood he did the best that he could. And that no matter what anybody did, that friend was going to die. You know, that was just a sad reality of a combat situation. You know, I'm very blessed. I can't even imagine what that would be like, to have to live through that and to watch your buddies get hurt, die, or to be injured yourself and hope you survive. or feel guilty you did because the rest of your squad got wiped out. You know, Clint could speak to that, but I can't because I'm not the expert. But prolonged exposure, I processed in the last few years over 100 veterans and got amazing results. When I got to the last year of my career, I reached out to some of the vets that I knew real well that had not done it and begged them to come and let me process them. And some did, and some just said, Jo, I can't. Not even with you can I do that. And I'm like, oh, because it makes a big difference. So those are the treatments I do. Nowadays, they have virtual reality with the prolonged exposure. I never was there long enough to get that, where they actually program it and it's your event. I would have loved to have learned that to see if it makes even more of a difference. And they do EMDR, which is the rapid eye movement, where they pair a movement with a treatment. I don't do that one. Some people got, Lynn Denny, actually one of my associates, got really good results with that. That was one I wasn't trained in. Medication is often part of the treatment with a psychiatrist, and you want a psychiatrist that's a trauma therapist or a psychiatrist that's versed in trauma. You don't want just any psychiatrist, because medication can be helpful and it can be detrimental. And what I would tell people is sometimes you need some medication because the volume is so high, you can't even focus on the treatment. So they have to reduce it enough to where you can endure the treatment. And so, that's another thing that can be helpful in terms of, one of the multifaceted ways of treating. But it's definitely a treatable condition. I hate to think that any one person has to die, and I know we're losing 22 veterans a day. I do the walk every year to raise money to reduce veteran suicide, because 1 is too many and 22 is a disaster. Because there's treatment options, so you don't have to die. And you don't have to be in misery to the end of your life. You just have to find the right therapist. Get somebody else. I said, therapists are like shoes. Some of us you put on and it's that shoe you've always looked for, and it's like a Hoka. It's a real comfortable shoe. It's perfect. You can wear them the rest of your life. Some you put on and it's like, ew, it's not going to ever fit. Because it's a chemistry thing. I mean, you want somebody that is a trauma therapist that's an expert in what they do, but you also want that connection. Because if you don't have that, you won't open up and do the work you need to do. You won't. And it's okay to ask for a different therapist. If you don't like the one you've got, it's okay to say, I'm not jiving with this person, I need someone else. That's reasonable. We don't all fit. And to ask for help, I mean, veterans are blessed that they've got the VA and the community-based clinics, the little CBOC clinics. Houston has 10 of the outlying clinics. I was in Tomball, but we have them in Katy. We have them just all over the place. There's Beaumont, there's Galveston, Texas City. There's a lot of them. So, and it's good because then you can go closer to home. They're doing telemental health a lot now, and I'm not a big fan, but they've made it much better since when I was doing it. I still, as a clinician, would not do prolonged exposure that way. There are people that do. I feel like I got to have, I guess I'm old school. I want the person in my office so I can be with them. And again, I'm going to give you a hug at the end if you need it. I can't hug a screen. Well, I can, but not the same result. For civilians, you can call 211, which is United Way, and ask for help. You can call your local mental health association and ask for referrals to trauma therapists. If you're in crisis, the new crisis number for suicide prevention is 988, not 911, but if you can't remember 988, dial 911, go to your nearest emergency room, call an ambulance, what I tell people is a suicidal crisis is as serious as a massive heart attack because it will kill you just as dead. It's just needing to survive the moment, because suicidal crisis will pass if you can just survive them, if you can just stay alive long enough to get to the other side. You'll be okay. But if you kill yourself, game over, and then we got no more options.
Well, it really wasn't under circumstances I wanted to start with. I was already 50% disabled from the VA, and I got directed that I needed to go to a program that was called Walk Through Vietnam, and I wouldn't go. So the VA finally told me, you're either going to go or we're going to take your disability away. So, not wanting to be there, I showed up. And there she was with a team, and a group of individuals that was really great to work with. But I didn't want to be in the room with all these other vets. And I don't know, there was maybe 20, 25 of us at the most. And I remember the first thing that we actually had to do, they had put a list of items on the chalkboard. And we were having to survive to this island and wanted to know what items we were going to take.
I remember that. Yep.
And I had just written on my paper that I'm just going to get off the boat and I'm going to swim to the island. I'm not going to take anybody with me or nothing until on that damn list. And that's how it started. And to be truthful with you, I didn't want to be there, but when it was all over, I was glad I was there. And Jo and I basically remained friends for about 33 years now.
Mm-hmm. Yep.
And it's been a pleasure knowing the lady, been a pleasure being involved with her work and the other individuals that she worked with there.
Well, the only thing I remember is in that group, and as we talked about last night, I'm not a Vietnam vet, obviously. I'm not a combat soldier, obviously, and I'm female. And the leader of that group that Clint came into was a combat vet, and he made me go around and ask each individual veteran if I could have permission to sit in that group because I was trying to learn how to work with combat vets. I was new to the field. And as Clint remembers, I went around and everybody was saying, sure, yeah, you can stay. And this one guy looked at me and he said, well, where the hell were you when we were in Vietnam? And I said, well, 6th grade, training bras, had no idea about the VA. And he said, okay, you told the truth, so you could stay. So, yeah, because I just was always, I tried to be truthful because I'm real clear. I'm not an expert. I'm just a regular person that was trying to be helpful.
When I first went to walk through Vietnam, I don't remember if the son was born yet or not, but my oldest daughter was, and my son can still tell you now, they know who Jo Clancy is and what she did for me.
This is my Why I Worked for the Houston VA for 30 Years book. And basically, it's full of mementos from veterans and their families. This was actually from my congratulations on your retirement was from the staff. But the first page has a lot of pictures, a lot of medals. Now, these are my pins for 10, 15, 20, 25, and 30 years of service. And then that's the Navy Trident that Clint gave me. And then I've got different medals that people in my Purple Heart, of course, that I didn't earn, but they swear I did. Just different veterans wanted me to have different pins because they thought I earned them. And that's a great sign of respect for me, that somebody would care about me enough to give me something that special.